I'm doing a pediatric demo and going to show how acupuncture works for kids, how kids handle acupuncture, and the types of treatments we might do for children. This is the pediatric patient, and this is her mother. And they've been coming for treatment. I'd have to check her chart, but I'd say it's been maybe 5, 6 treatments.
That sounds about right. That sounds about right. Yep.
And Maya, why don't you tell us what kinds of things we've been trying to work on for you?
My tummy aches, my sinuses, and I feel like I'm gonna throw up.
What was the last one?
I feel like I'm going to throw up. Not a good feeling. Who wants to feel that way at school every day? Yeah, so, you know, one of the big things that had been going on when Maya first came in was this, the sinus congestion, and we're thinking that maybe the, the nausea and sort of stomach discomfort is related. Do you want to say anything about acupuncture or why you chose?
I have actually done acupuncture before myself, and I felt like, the antibiotic was good, but especially with the stomach problems, I wanted to try to take a more rounded approach to getting her well and keeping her well. And I really think this is a great way to help stay ahead of the problems rather than just reacting to them. So there we go.
Without medication.
Yeah. Well, we did have to use some antibiotic at a point because she was really infected. But my goal is to reduce and eliminate infections before we're there. Before we're there.
How did you feel coming in getting acupuncture? Were you a little nervous about?
Yeah.
Pretty nervous at first, right?
The first time, I think Maya was very nervous.
Yeah.
But
how did you feel after the first treatment? Was it?
I felt really better. I had a lot of energy.
she did. That first treatment, that night, I was stunned because she had for like 3 weeks at least, totally punky. And I was amazed. It was a Friday. And we went out to dinner, and she came home and ran around, which I was kind of stunned because most kids at the end of the week of school are kind of like wiped out. She came home and was doing laps around the house. I'm like, whoa.
And Maya, did you find that the needles were pretty painful or not too bad? Or
It's not, like in some spaces it hurts a little, but mostly it doesn't.
yeah, that's what most adults say too. So. Just so everyone knows, the needles that we use are single-use disposable needles. So they're sterile, and then they go into medical waste. And each needle, they actually come in different sizes. I'm using one of the really thin types for Maya. For pediatrics, I use really like the thinnest we can use, and they're almost as thin as a piece of her hair. So they're very tiny. Sometimes they'll be a little thicker for adults. Most of these points you could also have in your community acupuncture treatment. And see, she didn't have a big kind of reaction. She's okay.
Maya even asked me, we were later in the week than normal this week, she even asked me, when am I going for acupuncture? And I was like, okay.
That's a good sign.
It is.
Yeah, that's the thing that I find most interesting about pediatric patients. A lot of parents report that their kids will say, like, I need my acupuncture, like in a sort of like demanding, like
that was the first time I
starting to feel
heard that.
weird,
I was like, okay.
And with pediatric patients, work with a lot of different kinds of things like ADD, behavioral issues, stomach issues, headaches, bedwetting, all kinds of different things.